if you look at the report today, Korea is actually very nervous about a second wave of infection. So, we want this webinar to really tap on the ideas and brains of many of you out there to help us, use technology to solve some of the problems that we are facing. We don't have all the ideas. In fact, we reach out to many people to help us. And the idea is really how can technology help us do a couple of things so that we are more prepared as we open the economy and prevent a second kind of like a wave from coming and affecting us badly again that needs to lead to another circuit breaker. I think the last thing we want is to have another circuit breaker. So if technology can help us manage that, all the better. And just like to introduce, Kok Yam is our Deputy Secretary in the Smart Nation Digital Government Office. But unfortunately, he's also now being seconded to Ministry of Health to help them coordinate many of the policy, operational, and some of the technology-driven issues. And my job is really to help him on the technology side. And we also have David Chua, who is our CIO at Ministry of Health. And his job is really also to help, pull together some of these very important technology-related solutions as we move towards opening up the Singapore economy again. I will come back again at the end of this whole session to talk a little bit about the community and how we want to help the community in this very difficult time. So stay tuned for that. So meanwhile, let me just introduce Kok Yam, and Kok Yam, please take the floor.
Yep, thanks very much, Cheow Ho. I just saw the participants list has gone up to 292, and I'm wondering if it's possible to have stage fright while on the webinar. Unlike my two good friends and colleagues, Cheow Ho and David, I'm the only guy here who doesn't really do and deliver the technology solutions. I think my job is somewhere between making PowerPoint slides and presenting them. Yeah, but anyway, let me just give a very quick overview of where we think we are and why actually we are reaching out to you guys to see how you can help us and how we can work together to deal with this common problem together. I think that the first broad point that I want to make is that this thing will be with us for a while. I think most people see that across the world until a vaccine, an effective vaccine comes out. This thing will be with us. People are already talking about second waves, third waves, and so on. So in terms of time, we are in this for quite a while, quite a long haul. And the second point is that it may start off as a public health kind of issue, and it still is a public health issue. But as you can see, as governments and jurisdictions impose different kinds of measures, the public health issues start bubbling into the economic sphere, and then it starts bubbling into the social sphere. So many problem statements out there, not necessarily by government. In fact, I was just reminded, my IMDA, which is our sister agency, reminded me that they are doing an open innovation call for Tech for Good, talking about looking for solutions for all kinds of things, from supply chain resilience to community engagement to helping us with migrant worker access and so on. So they are also looking for volunteers to help. So just do a call out for them. But the larger point is that there'll be many areas where we need more minds and more thinking about how we're going to deal with this as a society and as an economy. So just look at one issue, digital inclusion, for example. In the past, it's about how we have to build the apps to be inclusive. We have to make sure that people can access services in other ways other than the apps. But now it's so much more. It's about elderly still being able to access physiotherapy services via Zoom. It's about kids being able to get the correct level of care and education, even if they can't do physical schooling for a while. So digital inclusion suddenly becomes so much more, and the solutions need to be thought through in the area as well. So I come to my third point, which is that in a crisis, it's always not easy to sort of take a step back and say, okay, let's all come together and see what we can. In a crisis, our human instinct is to just sort of charge forward and do things and get a proper plan and not deal with the messiness of, oh, who's volunteering for what and so on. I must say that there are things where it is easier for someone to come in as an outsider, as a volunteer, and there are things that are a little bit more difficult. For example, if you're talking about scaling, ramping up the hospital systems and so on, it is difficult for someone to come in just fresh. There is a whole a jungle and a dense forest of existing systems and so on, and it's really very difficult for someone to come in and say, you know, I have a certain solution. But there are other issues which presents fresh problems and which we need really fresh ideas, fresh concepts. And one of them is this whole idea of as we open up the economy, as we allow for more social interaction and so on, what is a quantitative data-driven way of doing this in a risk managed manner? How do I trade off opening up another sector of the economy, oil and gas, just for sake of discussion, with opening up bubble tea stores, for example? How do I trade that off against allowing people to visit their friends and families versus some other form of economic activity in a construction site and all that? What is the metric and what is the data that I need to collect? And what is the analysis that needs to be done now? So nobody has done this because there was never a need to do this. So it is a fresh problem, and it is one where it is a very public sector problem. Only the public sector will ask kind of questions. But it is also one where we look to ideas around and suggestions and fresh approaches to this. So that's one example. I'll stop here, and I think what I'm supposed to do next is to wait for some responses and take questions. Right, Karen?
So two people have raised their hand. I saw would you like to speak? Kai Fong, you have to unmute yourself. Oh, okay, he says no. Maybe Raymond can go next. Raymond has raised his hand.
Oh, we have a very shy audience.
Yes.
Can you hear me?
Yeah, hi,
Yeah,
Raymond.
okay.
We can hear you.
Hi, yes. Hi, so my question actually revolves around how the private sector can help in this situation, and specifically providing of data, and whether the government is capable of actually basically taking in all the big data technologies that we in industry are using in order to do things like contact tracing and stuff like that. What is the situation? What are the systems in place for us to do things like that?
Yep. Am I supposed to answer, or we wait for a few questions? Sorry.
Maybe you can take this question first.
Yeah. Okay. So we take. I think that's a good question, and it actually is one of the key areas where digital and data can help. There is one aspect of it which is about collection of data, and as we do contact tracing more, as we need a greater requirement of knowing, for example, who has visited a certain place at a certain time, we need the help and the assistance of the private sector to sort of be able to feed us the data, so that when contact tracing is initiated for someone, it can the process can kick in, and big data can come in and help. That's one. In terms of fusion of collection of data is of course only the start. You have to fuse it, and then you have to sort of you have to fuse it, and then you have to sort of organize it to be able to make best use of it. I think there is a role beyond that for private sector innovation to look at how to look at the data and to see how there can be new discoveries to be made, whether it is about linking cases together and so on and so forth. But that one we need to probably have a slightly deeper discussion about what is the level of data access that we can grant to volunteers, to private sector companies and so on, because there is also a matter of personal data and personal information involved. But certainly we want to have many people staring at the data. If you are familiar with what some of the previous work of GovTech, this is about finding the rogue train, so to speak, which is the train that's infecting the other trains so that they are all spoiled. So I mean, in the manner of speaking. So yes, we are looking for people in that space.
Thank you, Kok Yam. There's next person will be Kush. Would you like to unmute yourself?
Hi guys, can you hear me?
Yes.
Awesome. So I just had a question. I spoke to someone at GovTech recently about. So I'm an engineer. I'm a software engineer, and I spoke to them about volunteering with one of the projects. But he said that GovTech has received like more than 500 applications for volunteers already, which makes it like really difficult for them to take on new people. So I was just wondering. So I've filled out the form, right? I'm sure there are many other people in my position who are just kind of sort of waiting now to see if there's an opening. Is there anything else we can do in the meantime, specifically if you have like technical skills to help out?
Yeah, so I think that for that question, I think maybe we can leave it to the end, and maybe Karen, you can talk a little bit more, or maybe Cheow can talk a little bit more about how we want to involve. I think we are quite it's an excellent problem. We have volunteers, but bear with us a bit because most of us are running around trying to meet deadlines and making sure our apps actually work and so on and so forth.
Absolutely.
So bear with us a bit if we are a little bit slow and there's a little bit of a lag. But we absolutely want to see how to involve you guys as much as possible. I know my answer is not particularly helpful. I think I'll leave it to Karen later to explain what are some of the next steps you can take in terms of.
Yeah. Okay. Yeah, great. Thank you so much. Yeah, I think that answers it.
Yeah. Cheow will be covering some of these areas later at the end.
Okay, yeah, great. I mean, I understand, especially in a time of crisis, the organizational overhead of onboarding new volunteers is probably, not very high up the list of priorities. Thank you so much.
Thank you. Yes, there's a question in the Q&A. Are you able to see it?
This is from Chin Hon, right? The question. Should I address that? I think someone by the name of Ia also has a question. So I address Chin Hon's question first.
Okay.
Okay, Ken. So this is about Trace Together. We have about 20% adoption. That's about 1.3 million downloads at last count, and I think we have run the app for a bit. I think we are for now the preliminary results are that we are quite happy with the what the doctors call the simplicity of app. That means people who are found to be or identified as close contacts are indeed close contacts, and so on. So we are quite pleased with that. The real challenge now is to be able to get more people on board with the app, and also to have it work across all different models of phones. It is a bit like the effect is, as many of you know, the effect is quadratic, right? Because it's a probability of a person having the app squared, because two persons have to have the app for the close contact to be identified. So we really want to make a push for it and have as many people download the app as possible. So that's the status.
Okay, thank you, DS. Maybe we come to the end of the first segment. Maybe we'll take the other questions that's not addressed in the later segment.
Yeah, so I can address. Yeah, okay.
Thank you, DS. If I may invite David next to share, please.
Hey, hi everyone. Hope you are having a great day today. Okay, so today I'll be here to talk a bit more about contact tracing and what is contact tracing, why are we doing contact tracing, and how it helps to stop the spread of COVID. I hope everyone can hear me okay. Can I have the next slide, please? Yeah, okay, so as a lot of you know, right, actually contact tracing is a technique that we use to reach people who have been in close contact with infected cases. And there's a reason why we need to do that, because as every one of you know, this COVID-19
spreads very easily, is very infectious. And in a lot of cases, actually, a lot of the transmission happens when the patient is at a pre-symptomatic or asymptomatic stage. And hence, the ability for us to get to the patient's close contacts fast and be able to quarantine them is essential in our fight with this COVID pandemic. So basically, what do we do today in terms of contact tracing is we need to get the patients to retrace his footsteps and interactions for the past 14 days. So where have you been? Who have you been in close contact with? And what's the sort of setting of this close contact? And then these close contacts will be called in, we'll access them. Those who are already symptomatic, we will send them for tests, and those who are not will be quarantined. And for the purpose of quarantine, for 14 days, they will not be allowed to leave the place of quarantine. The next slide, please. So what is the issue with contact tracing? Contact tracing is not foolproof. Firstly, is a very manual and laborious process. So basically, I bet, I can bet $1 if I ask every one of you here, what did you have for lunch yesterday? And I probably 90% would not be able to remember. And the reality is we need to ask the patient, where have you been to for the past 14 days? Who have you interacted with? As you can see, it's very laborious and it's very error prone because it depends on the patient being able to remember what he had for lunch yesterday effectively. And of course, the third thing that is about contact tracing is the current way of doing contact tracing represents a sort of imbalance in terms of the yield being proportional to the effort. So I explained that a bit more in the sense that we spend the same amount of effort trying to get the data out from a particular infected case. But the reality is the yield from that contact can range from anything from me quarantining 0 people to up to 20 or sometimes 30 people. And hence the effort to yield is not proportional. And the other fact of that is that the number of people who subsequently turn positive is also not proportional. So these are some of the issues today that we are facing with contact tracing. And I think as a lot of you know, we have started to roll out certain technologies to help us. So Trace Together is one of the technologies that we are depending on to help us uncover close proximity contacts. And of course, there are other things that we're doing. I think one of which is also, we are also looking around at the data sources that we have in allowing us to fuse this data and make better use of it. Yeah, the next slide, please. Yeah, so I think in terms of how do we envision the use of data and technology, is really the problem statement here is how might we improve contact tracing with data and technology, and that helps us better identify the at-risk people, and I would say probably in the best yield to effort ratio. And I've stated there that for the purpose of this problem statement, close contact is defined as a person who had been in close proximity with an infected case within 2 meters and for 30 minutes or more. Yeah, so I think this is the end of my segment. I'm open to take in any questions or ideas. Thank you.
Okay, thank you, David. Maybe we can take a look at the Q&A. The top voted one. Okay, it's adapting open source systems. Maybe we'll address that later. Cheow can take the question. David, maybe
I think I can come in on that. Stephen also tried to answer that. The reality is that, you know, like for example, Trace Together, we actually did open source the code. And actually Australia was the first country that adopted Trace Together, the Bluetooth protocol. And they've been quite happy in terms of what they've achieved so far. So we've been working with quite a lot of countries who have come to us directly, as well as through communities whereby we have like digital government exchange, etc., whereby we do share a lot of the things that we do, including testing data, etc. And for codes, we do open source as much as we can, so that other countries can benefit from it. So that's a direct answer to that question. Now, I saw that Andre De Meo is has just asked a question too, right? He asked a question which is there a way of moving efforts towards the predictive use of data? Example, predicting behavior that may lead to infection as opposed to tracking people that may have been infected. Now, I think what David has gone through, there are two parts to it. There's this thing we call forward contact tracing, and there's this thing called backward contact tracing. The thing about forward contact tracing is something that's very, very immediate. You go in there, you try to figure out who are all the other people that the infected person has come close to. And David defined the MOH criteria, which is within 2 meters and 30 minutes of exposure. So it's not as transient as you think it is, right? So there are relevant groups, for example, like your family, etc. Well, they're probably most exposed to you if you're infected. Your fellow workers, for example, who you work together with every day, it's probably quite people that you'll be quite exposed to. For the rest of the people, it's actually quite hard to find because these are people that most of the people are really not so-called they're quite transient. You queue in a supermarket, queue for 10 minutes. Now that's not really a way that you can easily get infected unless you go and touch something the other person touched and put it to your mouth or something like that. So it's a lot more difficult than that. Now, the backward contact tracing is something more interesting, and we have not done enough. And this is where Andre's question is. If we start looking at different groups of data, can we fuse the data to start looking at networks behind that? Groups that are related or unrelated, how do they, through first, second degree of interaction, actually get to the other groups? Now, those kind of activity maps, those kind of relationship maps, are actually a lot more effective in terms of looking at the entire spread of the disease itself. Now, have we done a lot of that? Answer is no, because right now we're fighting a battle. We're focusing a lot on forward contact tracing, but we're actually building a database to fuse data from different sources that we're collecting and use that to start analyzing and start doing what we call backward contact tracing, to be able to link groups as well as sources of the infection, so they will be better able to manage it as a totality rather than just about individual cases. Now that is very important, and the reason why we have not done it enough is that we have not have enough data. The data is not clean enough, but this is something that we're moving towards as we move forward. So that's another important question, right? Which I'm trying to answer. The other thing, which I think there was another question which I will answer later on, but not now. It's really about this whole COVID situation has really impacted a lot of people, especially in the community. A lot of startups, a lot of SMEs will find it very hard to keep the payroll on, etc. This is one question that I will talk quite a fair bit about at the end of this session. So hang on to that. Okay, maybe instead of me just chiming out, David, any other things you want to go on with?
No, I think you make very good points. Forward contact tracing fulfills a very immediate need because we have an infected case, hence it is a very immediate and focus to make sure that people who were in contact were quarantined appropriately. But the backward contact tracing and in some cases for epidemiological investigation allows us to identify source of infection, allows us to identify clusters, allows us to identify risky behavior, and this is where a bit of predictive element will come into play here. So yeah, Cheow Ho, you put it very.
Okay, thank you, Cheow Ho. Thank you, David. So Dan has raised his hand. Dan, if you could unmute. Dan, are you? Yes. Hi.
Hi. Yeah. Okay. Great. I have a question.
Yeah. Thank you.
You're right. Okay. The question is that there's an organization that has developed some solutions for this COVID situation, and actually, for the last 2 months, we have been trying to implement and raise awareness. But I think the ongoing interface with the organizations could be better. So on one hand, we have developed some solutions. On the other hand, I believe there could be some organizational red tape. And in these circumstances, how could the organizations like on the panelists today assist and help private industry players like us?
Sorry, Dan. I didn't quite catch the point on the organizational red tape. I would like to request if you can be more specific. Because
Okay.
I thought I understood you until your last point about helping private organizations. So you have to pardon me.
Right. Okay. What I meant by red tape means to say is that some organizations have either been clueless as to how to go about implementing, or rather, it's they might have to wait for their senior management or to take a call as to what to do with such type of solutions. So I would say that if there has been a more of a direct hand-holding experience with say the technology agencies, then I think a lot of solutions could be very much earlier being surfaced.
I think that to be realistic, I think at this point of time it is difficult to expect agencies to invest significant time in sort of hand holding and concierging different private organizations in this regard. I think what we can best do, as for example in this webinar, is to make as clear as possible what are our requirements, what are generally the areas that we think we need help and make that as clear as possible, so that innovative companies can be in somewhat correct ballpark when they approach us. Again, this is not a very specific answer, but it is a general answer to a general question. So I hope that's helpful to the extent that it is.
Yeah. Maybe I can just chip in a bit lah. I mean, from personal experience, well, it may not be intuitive, but I think where some of us are concerned, there is really a need to evaluate every proposal that comes in to really be sure that it meets the situation and the needs of the day. And because of the situation that we are in, we also can't afford to spend a lot of time to, like what Kok Yam say, to handhold every agency. And I do speak from experience that I do have, for example, a specific use case where company A says, okay, I can meet your use case. We spend 2 weeks briefing them on all the specific, the scenarios and everything. And 2 weeks later, the product that came out wasn't even close, and the company then say, oh, I'm sorry, I can't meet what you need. And hence that there is this evaluation process, call it whatever you may, that still needs to happen, at least for us to have a certain sense of what is doable and what is not doable. And I'm not sure if you call that red tape, but I think in some cases it is necessary. And it's just unfortunately a lot of us won't have a lot of time to spend on some of these efforts. Hence, we need to hedge our sort of our efforts and our bets as well from that perspective.
I appreciate the answers. I think moving forward, since this platform is made available today, I would have just one question: is that how do we move forward if suppose that which would be the paramount agency, say, supposed to expedite solutions from the private industry?
I think if you're thinking about a digital, if you're thinking about a digital solution, I think I'm not sure whether my colleagues appreciate this, but I think you're welcome to touch base with GovTech first. I mean, if it's very clearly related to specific ministry, then you have probably have better luck going at that. But I think we will build ourselves as the first point of contact if it is a digital solution.
Right. I appreciate the answers. Thank you very much.
Thank you.
Yeah, I'd like to answer, I think, two questions that was floating up the list, right? One is by Thomas, right, who says that, what's the government's position on privacy? And understand that Trace Together, we are not collecting. So I want to assure you that in Trace Together today, it's not collecting location data. That's why we were trying to integrate, or we are trying to use the data from Trace Together and the data from Safe Entry. So when you go to NTUC today, you scan your IC, for example, that you're going to NTUC, for example. Those data we're trying to use to fuse it together to also help us in contact tracing. It's not as accurate because it's, there'll be 1,000 people going to NTUC every hour, for example. But yeah, at least give us also certain level of ability to trace some of the more difficult cases. But this is not a perfect situation. And to be honest with you right now, the contact tracing is actually very difficult. That's why we wanted to get all your ideas to come in to help us, because many of these things, if you don't want to violate privacy, you want to do this, that, and everything, you end up with actually very little data to play around with. So if there are fantastic answers that you guys can give us, I'm more than happy. The other question I want to answer is from Jordan, who says that I know I answered about open sourcing. We are more than happy to use open source APIs or solutions also. If there are those that are useful to us, actually we are more than happy to use that. So it doesn't have to be an invented here syndrome. Otherwise, you won't have to be doing this call right now as we speak, right? Another question I think I wanted to answer a little bit more from what Kok Yam said was that many of you are curious about Trace Together. And I think a big portion of you here are technical people too. You'll not be surprised if I tell you that the Trace Together app has been quite successful on Android phones and has been not successful on Apple phones. And I want to be very honest about this, because at the end of the day, you know very well that in the iOS system, background scanning of Bluetooth is not possible. So whenever your app goes into background, it becomes totally ineffective. That's the problem with the Apple iOS environment right now. There's a lot of work being done with both Apple and Google, because Apple and Google are trying very hard to come up with a solution that could solve this problem without violating the privacy of people and without draining the battery life of the phone. So that is something to be seen. The nature of this changes every hour. I mean, my poor colleague Jason has been on calls to them nonstop, and they keep changing their point of view in terms of how they're going to implement the EN protocol. But this is something that I think hopefully if Apple can loosen up, actually will actually help us quite a fair bit. And we're not the only country fighting this battle. Many European countries, Australia, New Zealand, everybody's fighting the same battle as we speak. So I just wanted to cover a few more questions because there are quite a few of them. Yep, thank you.
Thank you, Cheow. Thank you, Kok Yam. There is a Zetlin has raised his hand in chat. Would you like to unmute yourself?
Yes. I just want to follow up on Thomas' question about the telco data. What has been the consideration around this? Because we know for a fact that countries like South Korea are using it. My team and I actually have worked with CHP in Hong Kong to conduct live trials using telco data, and we were able to successfully detect people in taxis and minibuses. And to your point about backwards contact tracing, we believe that the telco data could also help in that. So I just want to ask, what is the stand or what is the consideration around telco data?
Let me take that. Let me take the answer. I think if you have good information about how this is being done in some other countries, and as you mentioned, you are in a team that's directly involved. I think we'll be quite happy to have a separate discussion with you on that particular matter. I mean, as a general point, the government's approach to data has always been quite consistent. We take what is needed to do our job, nothing more. As far as possible, where practicable, we try to seek consent, and in all cases, we try to protect the data as much as possible. This is a resource that belongs to people. This is their data that is held in trust by government. So we don't have data that is considered not too scary and so on, so long as there's a real purpose to it, and we can protect it well, and as far as possible, consent is obtained. So we are not close to any ideas. It's just we need to know that it is actually useful for our purposes. No point collecting all kinds of data if it is not useful for the purpose of contact tracing. For now, our theory is that proximity data is the most important because it tells you empirically that someone is within X meters for the past X minutes. But I think we are quite open to other ideas of looking at other forms of data, especially if they've been proven to be helpful in other jurisdictions.
Yeah.
Okay. I want to extend it a little bit on a topic which I think is quite interesting, right? We are always caught between this concept of how much privacy is important and how much solving a crisis is important. This is a very difficult question. It's something very hard to navigate in between, right? Meaning that in a crisis situation like this, do you say, forget about privacy? Because telco data can be a big violation of privacy. I mean, basically, people don't like it. So we have not taken that point of view at this point in time. The other question I think that's quite important is that, do we take a surgical approach or a maximalist approach? Now, in countries like China, Korea, and many of these countries, etc., they have taken quite a maximalist approach sometimes, in the sense that if I find a case to be in a building, for example, do I quarantine the whole floor, right? You'll get a lot of false positives. Is that acceptable? Again, this is a very difficult question to answer. What level of false positive is acceptable versus what level of false negative? So this is really, again, a very challenging question, which I think it's not a clear, simple, black and white answer that we have to take. So again, I hope you understand that the so-called the situation behind this.
Yeah, thanks a lot. I totally understand. This is the kind of debate we were having as well. And just to your point about false positives and false negatives, in our trials, we were supposed to keep false positive down to 0, and we were able to achieve it. So I think I will follow up. Yeah.
I'm more than happy to follow up. I think it'll be a good thing. So we're happy to talk further. Huh? Yeah.
Yeah.
Thank you, everyone. So we have actually flowed into the combined Q&A. So we'll continue to take questions for the speaker. But if I may also remind participants, if you could if you have any ideas that you'd like to share on how we can solve some of these problem statements, please feel free to raise your hands and share. If I may invite Jordan to speak next, please.
So I'm going to make a general observation here. So I've been working in tech for over 30 years. And an error I've seen again and again is to substitute chasing after a technical solution for making policy decisions. And in this whole discussion of contract tracing, there are a whole bunch of things that are policy decisions that limit or open up areas of where we can go. For example, what level of infringement on personal privacy is acceptable? Can we work with anonymized data? What is the turnaround time that we need? Until these questions are answered, and in so many other things, it's going to be difficult. When we open up, are we going to accept a virtual queuing system? I can build you a situation for virtual queuing, but the decision to adopt virtual queuing is a policy decision. You can't substitute technology for policy, and policy is where it gets hard. We can build pretty much anything, but we need to understand what are going to be the rules of the road, what are the guardrails, what are the acceptables, and what are the unacceptables.
Let me just I think as a matter of principle, I agree with you. My only addition to that is that it is not necessarily a unidirectional thing. I think technology and the type of solutions that engineers put on the table does have an impact on policy. If we are to prove that a certain approach that requires a certain set of data is particularly effective or efficacious, then it does have an impact on the policy as to whether we do need to collect that data. Similarly, if that piece of data is not particularly useful, there really is no need for us to soup up people's data in that regard. So I think policy and technology and the solutions that engineering can provide they do affect each other, and they do impact one another and the
do, but I'm just going to be honest. I'm feeling a fairly deep lack of clarity here in terms of the problem statements, and I'm just telling you that I've seen this pattern many times in my career, and the outcomes have not been pretty.
Yes, but don't worry about that. I mean, I think this is not our only this I hope is not our only interaction. I think we have to start somewhere. And as we dive into the more specific ideas, I think there can be other processes that can come in to pursue those ideas.
Yes, thank you for asking the question. Hong-Yi would like to speak next. Would you like to chime in? Hong-Yi.
Hello, can you guys hear me?
Yes.
Yes.
So I just want to set a little bit of context as to how this is working. So, John, you're absolutely right. There is a lack of clarity right now, and the problem is that we've got a lot of problems across the government, and we're not entirely sure what what the possible solution space is, and therefore it's not surprising that we don't have policies around that solution space, if that makes sense. And so essentially the government is operating to whatever degree possible within its current set of what it perceives as capabilities, meaning that a lot of things are still manual. A lot of things which you process maybe a throughput of 3 or 4 or 5 people a day now need to do 500 people a day, and is digitizing that information that previously wasn't digitized okay? We're not sure, because the option to digitize it isn't even on the table yet, and we haven't had a chance to examine it. So I think the way to sort of look at this idea sprint is, it's not so much about the government defining a set of very clear boundaries and then you sort of play around inside it. The idea of this idea sprint is for the government to whatever extent possible, at least from our side, describe the problem the best that we can. So we can ask questions about, for example, how contact tracing is done now, what's the mean number of people, what's the average number of people that get contact traced, in the case of opening up the economy, what ways, how the check-in systems currently work, do employers, do people mostly have Android or Bluetooth phones, things like that. So questions about the current situation we can describe to you, but questions about our current constraints are very hard to describe, because the answer is whatever was a constraint 3 months ago is needs to be re-examined now. And so I think what we're looking for here is less of a optimize within the rules of this hackathon, and more of a we have a problem, we're just trying to deal with it. And what we're hoping, what I think is a sort of the ideal outcome from this is that we have the problem as best as we can. And as people are asking right in the chat, they're saying, how can I help? How can I do this? And for the volunteers, yeah, you're absolutely right. We don't have the bandwidth to manage 300 volunteers. But what we do have is we have the bandwidth to share our problem statements, and for volunteers who are motivated and think they have a problem to solve, build a prototype, build a demo, and then show that to us, so that then we can start thinking about whether or not we should take that and turn that into an actual, integrate that into our actual operations. So the thing that I can say is that so far, I mean, no promises, but so far, if something is effective and necessary, we've been pretty good about moving the policy around it in order to get that implemented. So a lot of the stuff we're doing right now, like locking down the country, constraining public transport, none of these things were policies 2 months ago. But because we deemed them necessary, we could move the policy we figured out like on Kok Yam and Cheow Ho and David's side, we figured out what policies that we needed to move in order to allow us to implement these solutions. But what we need, I think, from you guys is we don't expect you to have a deep understanding of government policy. What we're hoping is actually quite ironically the opposite, which is that as people who are outside of government, as people who are not bound by the thinking of what traditional government operation looks like, what are some solutions that you think that we should be doing that we're not right now? Show that to us, and then we can figure out a way of getting that launched. Does that make sense? Hopefully that clarifies things for some people.
Yeah, Hongi, I think that was a very good explanation, because at the end of the day, this crisis is really unprecedented. None of us could predict what's going to happen next, or what's happening right now in some ways, right? And it's been very tough on, I think, all of us. And sometimes we are so deep down, dug into it, that we need fresh pair of eyes to say, hey, why don't you guys look at this thing? It's so sensible. Why don't you guys look at it? And we're more than happy to say, yeah, this is something that I think we should really, adopt and try to solve. And the important thing is that if we define the problem very tightly, then, at the end, we will kind of restrict the kind of creativity that's needed to solve many of these problems. And we really urge you to help us with this, because this is really a national emergency that we are appealing for help, actually.
Yeah. So just to sort of recap the structure of this a little bit, apologies. I'll stop. I'll hand back off after this. But just to recap the structure of this, basically we're just this is just we came up. We're doing sort of on a rolling basis, and so we're having a couple of sharings about contact tracing and reopening up the economy today. We have a couple more sessions on Monday and Tuesday and Wednesday with different teams, all dealing with different problems, from like sort of mental health to to helping businesses get off the ground, get back on their feet, things like that. And then the idea is that what we can do, we're trying to basically get out of your way as a bottleneck. So traditionally in government, there's a lot of gatekeeping, there's a lot of like different rules and regulations. We're trying to get out of your way as fast as possible so that we can share our problems straight to you. You can present your problem statement, you can present your proposed ideas straight to the problem owners. I believe it is on the 17th, if I remember correctly. And then that way we break that bottleneck as fast as possible. And that way, even if we don't end up, we probably won't end up implementing everything everyone shares here, but at least the answer to the question: have the policy owners seen all the best ideas that Singapore has to offer, that Singapore has to offer in terms of how we might do this, and therefore are they thinking in that larger space of not just what we have been doing, but is possible? That's the place we're trying to get to. So I would say don't worry too much about whether everything is technically possible, about everything is policy-wise possible. I say don't worry too much about what our constraints are. I would say, but what we're looking for is we fully admit, as people in the government and having been in the government for quite a while, our conception of the kinds of things that can be done is far more constrained than probably than the combined sort of wisdom of our Singaporean sort of diaspora in that sense. So yeah, hopefully that makes sense. I mean, like David and Cheow Ho and Kok Yam, they can talk a lot, in very much detail about how our problems go, and like what we're doing right now, and what our specific challenges are, and like what's still manual and things like that. And then hopefully that gives you a sense of that helps you think of, well, actually they're doing this and this, that's really dumb. Why don't they just do this? And this is the opportunity for you to do so.
Yeah, I think.
Right.
I think that's very helpful. So I'm looking at some of the questions that's being posted. There's a question about air travel. There's a question about which data is sort of kosher for us to take, and so on. And I think what just to re-emphasize what Hongi said. Don't worry about that for now. Even if I tell you the policy of air travel today, it may not hold in the next 3 weeks, in the next 2 weeks, and so on. So put a solution, put an idea on the table, and then we can go back and then we can review the policy, and that's kind of my job, other than doing up PowerPoint slides, and we can make that work in an optimal way for the nation. Don't look at policy and rules as a constraint to this. Rather look at the broad set of problems that we have and how best we can sort of solve it.
Thank you, Ho Ying. Thank you, DS, for the questions. Maybe we have another minute more or so. If we could take one more question, Jim, would you like to unmute yourself?
Can y'all hear me?
Yes.
Yes, we can.
Yes, I want to talk about the importance of latest signs of asymptomatic infection of COVID-19. This increasingly, it become clear from CDC that it's actually contribute to a large portion of infection spreading without symptoms. And then the question is, because of that, how would you design contact tracing app to cope with this, right? And can you do something that will immediately break the change of infection early so that you don't have to involve many people into laborious tracing? So these are some of the thinking that I would like to put it out for challenge, and also the future of tourism is for the country to open, and whether when you open, do tourists come, depends a lot on how the government communicate the measure taken to protect tourists coming to the country. And one of the most differentiating factor very soon, in 1 to 2 months time, maybe not now, is how government communicate their strategy to manage asymptomatic infection. And also one of the panels say that whether we take a blunt way or more precise way of handling, for example, when a building with somebody infected, right? Are we taking a blunt way, or are we taking a more precise way, smaller group? The question is, how would a country like Hong Kong, Taiwan, South Korea, China deal with this, right? They have a lot of experience dealing with SARS version 1. If they are doing very blunt way, do they take into consideration that this asymptomatic infection is much more worse than they ever deal with? So they rather take a blunt way. So these are the challenges or problems I'd like to share, and maybe you all can think about it. Thank you.
Okay, maybe let me try to sort of take that a bit. And you're exactly right. These are the problem statements, and these are the challenges that we're trying to overcome. And I would say there are different strategies that need to come together to make this happen. And we learn new things about this pandemic every day. Asymptomatic transmission is one of which. So broadly, contact tracing and testing, I think these are the two strategies that we are currently sort of putting our bets in. A regime of very aggressive contact tracing, as well as expanded testing strategy that allows us to break the transmission chain early. And you mentioned SARS, and to be frank, a lot of our institutional knowledge was built on SARS. But as we start to operationalize them, we also realized that a lot of the parameters associated with SARS do not apply to COVID. SARS has a lot of super spreader events, but the transmission largely happened only after the patient is symptomatic. Whereas for the case of COVID, it is slightly different. And hence the ability to change strategy is also important. And that's also one of the reasons why we are here, trying to also ask for help from the community at large to help us. Yeah. But I do believe that an aggressive contact tracing, as well as a very comprehensive testing strategy, is where our focus should be.
Thank you, David. So we have come to the end of the Q&A session. If you could invite Cheow Ho to do the closing, please.
Yeah, I was looking through some of the questions, and a couple of questions asked something quite interesting, which is that this is very much a multifaceted problem, and it goes beyond technology. Actually, it goes beyond a lot of things that we could even anticipate. And if you look at it carefully, one of the things I was mentioned about was about unemployment. This is quite a tough situation for many people. I got a lot of friends, colleagues, ex-colleagues, etc., coming to me and say, "Hey, this really great guy who used to work in the startup is now out of job because the startup just can't pay him." Or another guy coming and saying that people have been put on furlough for like 3 months, 6 months, etc. It is tough for everything, and we have benefited a lot from this community. All of you here helping us in a webinar like this, or coming to our StackX every month in the last before the COVID crisis. So we want to do something for the community. Karen, can you move to the next slide? Yeah, we really want to help the community in times of crisis. So we are very, very keen to actually onboard professionals, tech professionals, software engineers, BA, data scientists, cybersecurity, people with good skills who might be facing a transitional problem right now of, the company not being able to hold them for the next 6 months or something like that. And we're offering temp contracts as well as permanent employees. Less permanent because we just don't have the headcount to take so many people in. But we are more than happy to offer 6 months, 1 year, 1.5 years, 2 years contracts to people that could really help us solve this problem. In many ways, we are reaching out to you to talk to your friends who have been displaced or who are unemployed right now, but who have good skills to join us, right? Join us to help us solve these problems, fight these very difficult crises that we have today. And we are committed to really make sure that our people are deployed properly, because right now our own staff are stretched to the limit. And somebody asked a question just now about volunteers. Yes, we are very, very happy that we have so many volunteers. We have brought in some people with very specific skills to help us in certain things. But it's quite hard unless there's a very strong commitment on timing. You can't you can't have volunteers just for like one day a week or something. It's just very hard to get things going. And our team are really stretched right now in terms of being able to really help people on board. But if we can have people joining us even like for a contract of 6 months, a year, or more than that, it really helps us a lot. It helps us a lot in terms of shaving some of the effort off people who are working 16 hours a day solving some of these COVID-related issues. So this is an open call. Help us battle the crisis. Help us get back to work in a normal way as much as possible. And we're going to have a couple of tech hunts going forward. But don't be mistaken about one thing. We really need people who can hit the road running. We just don't have time right now to train other people. We will do that in time to come, and there are other schemes for that. But for this particular thing that I'm talking about, I really need people to hit the road running because we need a lot of people to help us. And I hope you will scan the QR code, refer it to your friends, colleagues, family, people who have been affected, and who really want to just do their bit for the country. This is the right time to do it. So I hope this is our way of helping the community in a time of crisis, because the community has been very kind to us. So with that, I'm very thankful for all of you for attending. We had something like about 340 people at its peak for this webinar, which is tremendous. We just announced it early this week. The other thing also is that, as we mentioned, if there are ideas that you think can help us solve these problems, there was a QR code, submit ideas to the developers portal. We will go through every single idea, and if it makes sense, we are more than happy to invite you in. If you want to volunteer, please volunteer. We can even put a team around you to help develop it if we need to, based on the contract people we are hiring that I talked about just now. So this is all about getting us back to business, as fast as we can, but doing it safely and with the help of technology. So with that, thank you very much, and God bless. Make sure everybody stay safe. Thank you.
Yep. Thank you, Cheow Ho, and thank you all the speakers. So if any of the participants would like to stay back and for short networking, you're welcome to raise your hands, and we can take a few more questions. Jordan, do you have a question again, or?
No, I don't. That's just been there. You never cleared it.
Okay.
I mean,
Raymond, sorry. Yep. Raymond, would you have another question? Raymond.
Karen, David here. I need to drop off.
Okay.
I need to drop off. I have another team waiting for a meeting with me.
Okay.
I would like to thank the community here. And if there's anyone who has questions for me or otherwise, yeah, feel free to drop me an email, please. Thank you very much.
Okay.
So it's just a clarification. I was not completely clear how to take part in the idea sprint. Is there a form or something that we need to submit in order to get our ideas across? Or I mean, what's the idea? What's the point? Or how is this going to work?
Yep. So if you can scan this QR code, we're collating ideas as well as volunteer efforts here. So actually the team is participating here as well, Russell and Karen, if y'all would like to chime in. Okay, Russell.
Hi, Russell here. So thanks for that question. I'm part of the organizing committee for the idea sprint as well. So as Karen mentioned, you can go to the website, go.gov.sg/COVID-volunteering. You'll find a link to the idea sprint there. So the ideas or the problem statements you've heard today from Cheow and from GovTech are the first of a few that you're going to hear through various webinars that are running next week as well. We're in the midst of confirming the details of those, but in order to stay updated, what you can do is you go into the idea sprint link, which you can go through the URL. We'll update everyone basically through the dev post site. So we're hosting that on a devpost.com website. You can use that to submit ideas. You can use that to also stay in touch when the next webinars will be, and we'll post more details, more resources as and when they're ready there as well. Yeah, let me know if there are any questions on the idea sprint itself as well.
Okay, no, none. Okay.
Yeah, just to clarify as well. So when we are saying ideas for the idea sprint, I think it's what the panelists mentioned earlier. It's kind of what Karen and Hong Yi have mentioned earlier as well. So the idea here is really to say for all these problem statements that we are facing across government with regard to that are arising out of COVID-19, we're just sharing these problem statements with the tech community yourselves. We'll love to hear the ideas you have, prototypes you have. If that leads to development of a prototype, even a production-ready thing, if it's a proof of concept, it's just an idea, by all means, submit it. I think it's what Hong Yi's mentioned in the chat as well. It's not about making the most slick thing per se. It's just about how can we deploy, how can we get your help to deploy the best efforts to try and address these contextually specific problem statements that we're going to raise through that site. Yeah, thanks everyone.
Okay, thank you. So with that, thank you everyone for attending the session. We'll see you at the next webinar. Thank you.